Okay, there's the little record thing. It says REC, that's how I know. I'm very technically. Anyway, what I want to talk to you about now is that this is basically a philosophical argument. And in your planning that you're going to do this, I paid for this cash, about 20 grand or so, somewhere around there. And again, with Dr. Jacobs and Dr. Gomez down in Miami. And it was a fascinating experience and something you really need to consider if you do this. Some people are able to get it done on insurance, and I guess they're not going to care enough to do it otherwise to try to make the whole experience better. My insurance wouldn't cover it. It did cover the post-surgery, or excuse me, the pre-surgery stuff, because you have to have a heart catheterization, which is, they go into your crotch right next to stuff you really care about, and they stick a tube all the way up into your heart, and then they put a dye in there or radioactive something, and you're looking at it on the screen, and it's just fascinating as all get out, because you're seeing your heart pumping, you're seeing all your veins, and my veins were just slick as a baby's butt. If I don't know if that's an actual term, but that's how slick they were, and everything was good, and they could give you a DVD of it, like a film of your heart pumping and all your stuff, they'll give you that. I didn't get one. I don't know why. And then you got to have another heart workup and a pulmonary workup and things like that. And then what I did was the insurance would pay for that, so I used the insurance to pay for it. Some of that stuff is in the hospital, like the heart catheterization. You got to go to the hospital to do it and check in and everything else. And I have to tell you, the insurance portion of it, because insurance is, they talk about healthcare rationing, insurance rations healthcare. Not nearly what the government will ration healthcare, and not nearly as bad as the government will do it, but it still happens. There's always healthcare rationing if you're having some other system pay for it. The insurance, it was a PPO or an HMO, I don't remember what kind of insurance I had, but let me tell you, it was just terrible. And you need to prepare for that if that's what you're going to do. They treat you just like your cattle. I went to a big giant, I'm not going to say the name of it because it's not fair, because it wasn't just them. It's all hospitals are this way now. The way the state of healthcare, the way it is, and you go in there and you just feel like cattle. You feel like you need a bell around your neck and you're mooing, and they took me in there and because they're trying to hit the numbers, you know what I mean, and they put all these sensors on me to get me ready, they have to get some readings of some things, and then they are going to do the heart catheterization. I drove all the way to Miami from Key West to because this particular facility said that they could go in through my wrist instead of my crotch, and I don't like anybody messing around. Well, almost nobody messing around down there. There's a few people I would allow to do that, but they laid me in there in a room with utter sensory deprivation, and you have to lay still. And all it was they just needed a couple of minutes worth of cardio or something, and a few other things, and then they could have gotten on with it. But all they do is they just plug everybody in, because there's a bunch of other people there for the same thing, and they stick you in these holes in the wall. There's not even any TV or anything. You just lay there, right? 4 hours. I get up, and I can't stand it anymore. I can't lay there, and I've got all this stuff hanging on me. Well, I made a bleep or something, and so in comes this orderly, and you're not allowed to do that. You're going to lay me down again. And I said, oh, really? Is that true? Well, I don't care, because I don't think you've got enough ass to put me back in the bed. I can tell you that right now. So you have to lay me back down, because this is how it all went. And it went like that. And I said, well, here's what I want you to do with your rules about that. I want you to maybe type them. Don't even handwrite them. Type them out very carefully, so that I can see them and read them. And then you can fold them very, very carefully. I would recommend at least one pointy end on the, because you need to then push it where the sun won't get on it. You know what I'm saying? And, well, we're going to have to get the doctor in here. I said, well, there's a novel idea. After 4 hours or whatever else, and you get me here at 5 in the morning, yeah, getting the doctor in here. There's a thought. Do y'all at the hospital ever think about that sort of thing? And then they get me in there, and then they can't do it. They said I had little wrist veins or something. They didn't predict that. leave me in the hallway naked. You know, people come to visit their friends, leave me in the hallway naked, you know, because I'm cattle. And with my little, because I was large, and it makes it look really, and it was embarrassing and humiliating, and it was just, they just don't care. It was horrible. And the other parts of it too, the same thing with the cardio workup and the pulmonary workup that I did. It was back down in Key West, and this is terrible. Just treat you terrible under insurance. The surgery itself, the vertical sleeve gastrotomy, I paid for cash. I almost wish I could have the surgery again, just because it was such a wonderful experience. It was like going to a 5-star hotel. I had Dr. Jacobs and Dr. Gomez in there. Dr. Jacobs was my doctor. Marcia Jacobs was my doctor, but he just threw Eddie Gomez in for free. You know what I mean? And I had 4 anesthesiologists. I suspect they wanted to make sure I was really, really asleep, or check each other or something. Bunch of nurses, you know, flowers in the room, you know, and I mean, you know, I got the room all to myself before the surgery, and you don't get a last meal because, you know, they're going to cut your stomach, so no meal, but you know, flowers and some liquids, you know, and they try to make you comfortable, and do you like the flowers? I don't know, you know, you take advantage of it, you behave badly. I don't really, I'm not big on tulips. Take the tulips away. Mr. Berman he hates the tulips. Bring him roses. We must have roses. And, you know, I didn't get a smile out of that nurse over there. You need to give her a talking to. And you know, they take her and gave her a talking to. She had it coming. And I mean, just tremendous service, tremendous care, right before the surgery, after the surgery. And it's, and I tell you all that because it's might factor into your calculations in the big health care debate we got going these days. Obamacare is probably headed for the ash heap of history anyway. Hallelujah. But it's horrific when you do this. What basically healthcare, you think it's expensive now, just wait till it's free. And what they do with the fairness of having government health care is make sure that everybody has equally bad health care, you know. And they say, well, insurance companies ration too. Well, not nearly as much as the government does, I can tell you that. So I recommend, if you can possibly do it, paying for it cash. I'd say pay for every last bit of it cash, and it'll make things a lot easier on you. Again, like I told you before, you know, it's a rough couple of months right afterwards, you know. There's no pain during the process. I mean, the afterwards, there's no pain or anything like that. You do have a lot of transition as to what you can eat, and I couldn't eat chicken. A friend of mine, Al Laredo, he could eat chicken, he couldn't eat beef, which worked out because he's Cuban, and if you take chicken away from a Cuban, they just jump off a bridge, you know. I mean, that's it. You can't take chicken away from a Cuban. Or pork. I could eat pork, and he could eat pork too. So that's good. And the weight loss is real rapid, very, very, very rapid. 15 pounds a week. I think I had one week there I lost 20 pounds in a single week. But then it slows up pretty quick after a few months. That's like, wow, rush, you know. It just slows up and stops. And not stops, but starts going a lot slower. Theoretically, my skin was going to catch up with me. It didn't catch up. It's hanging there. And but you don't have to worry about pain. You don't have to worry about anything other than I would tell you this. If you're going to do this, do not overeat. You will pay a massive price. A lot of pain. You'll throw up. I mean, it's just really terrible, and this is the way it's going to be for you for the rest of your life. This is another thing you need to know. You know, you have a finite stomach there, and it doesn't stretch. So now you're going to do it anyway. Because you know why? Because you're a fat person. And you got to be a fat person by forcing the overeating. If you got to take a stick and, you know, jam another couple of wafer-thin slices down there, you do it. And so it doesn't matter that I warn you, you're going to do it. And you're going to experience the pain. And you're going to experience the you know, fire hose-like projection out your nose holes and mouth and everything else. But you'll only do that a couple of times, and it'll give you religion. And then you won't. You'll get to the point where, when you're eating, you'll take a bite and you'll be talking to someone. Well, what do you think about that? Yes, I think he's as stupid as well. He's always been stupid. I hear they did. And you'll go like that. You'll get this little feeling, you know, and you'll say, whoop, and the fork will hit the table, you know, and you'll go, done. And you push it away. It's that clear a delineation, you know, and it's just something that happens. You know, it's not like they got to train you. You get trained, you know, the hard way, but you get trained, and that's the kind of thing that you can expect. But it's just so wonderful. I just want to tell you, it's for all of you out there that you know, are wondering about it. I mean, I got no. I'm in better health now than no high blood pressure. You know, my blood pressure went 120 over 80. Doesn't matter what I do, and I'm just, you know, my cholesterol's, you know, there's people who kill for my cholesterol numbers, even with this rotten diet that I'm going to eat. The next installment, because I'm going to cut this off now. I think I have an email thing there set up or whatever else. If anyone wants to talk to me about it, it's somewhere. Look out here. I don't know how it works. You kids today with your transistor radios, you know how to do that stuff. But in the next installment, I want to show you something. I'm going to show you my room here in Afghanistan. I know you said, what the hell's that got to do with it? Well, it's got something to do with it, and I'll show you why. And then that's going to be the last installment for just a little while. I'm going to start the workout program, and I'm going to try. Then I'll show you what's under the T-shirt. Once I slab on some muscle and I look really good again. There's been some talk that I would go and get one of those, what do you call them, women. I don't think I'm going to do that, you know. I doubt it. You know, they ask you questions and things, and I don't think I can deal with that at this stage of my life. So, but I'm in a better position now to do that if I had so chose to do so, which I'm not. Anyway, that's it. I'm entertaining questions later, and I think that I've covered just about all that stuff. I'm going to stop this now, and then when we come back, I'm going to give you a tour, you know, and show you the significance of why I'm giving you the tour. Okay. So, hey, you know, do it. You do it. And go down to Dr. Jacobs and Dr. Gomez. They're fantastic. South Miami, Florida. They work out of South Miami Hospital, I think. I should give their number. I should say, you know, put a number on the bottom of the screen for them, because I'm just so happy with them. You know, it's amazing. See you in a bit.